All right. Hello, everyone. Welcome to this fabulous Monday. And I wanted to give another just very brief update this time about the impacts of COVID-19. As I'm sure by now, it is truly impacting everyone. And kind of the big picture that I'm thinking about here is the progression of how a public health emergency propagates through society and then how it starts affecting individuals. So I think everyone now, most people, right? And obviously, there's still those outliers who just aren't getting it and doing their own thing. But for the most part, people are starting to get it, right? They understand that there's this virus, it's spreading, and we need to now socially or physically distance ourselves. And those things are now being in place. And we're going to continue to see closures of everything, right? We will see, if it hasn't already happened in your area, there'll be total shutdown of everything. Restaurants, they'll still probably be doing delivery, takeout and stuff like that. But otherwise, expect complete shutdown of everything. All right. So start thinking about your life. And I think I commented on this last video, but now start adjusting to what that's going to look like for you. Uh, Here are the consequences from the public health standpoint. And they call it public health for a reason, because what happens here is it's not just about the disease or the virus or the bacteria or whatever it is, and infections and virology and bacteriology. Now what we see are the secondary effects, right? The primary effects are the spread itself. And you could think about this as, think about how a pandemic, think about a pot of boiling water, and you have the flame on, right? Eventually, what you'll see is one little bubble rise from the bottom up to the top, and then you might see two rise from the bottom up to the top, and then you get groups of 4, 16, 32, and unless you do anything to that flame, you're going to have a roaring, vigorous boil in no time, and it's going to continue. So that's like a pandemic. And then all those other effects spill over into socioeconomic and then secondary health problems, right? So the restrictions that are applied lead to, right, other things are still happening, right? The common things are still happening commonly. So people still have the day-to-day illnesses, and then they can't seek the care that they need. And so people end up having these secondary problems health-wise. But in our case, and I think the majority of people, what we really need to be thinking about here is the socioeconomic impact here, because we don't know how long this is going to last. There's no idea. I mean, the 1918 pandemic lasted 2 years. I'm trying to find out how long people were isolated for. I'm still working on that. I'll get that to you, or if someone knows, great. But still kind of working out what those details looked like what the days looked like for people. But my message today is simply, now when you move into this phase, the phase where I kind of call the socioeconomic impact phase, the way through that. So the way through phase one, social distancing, physical distancing, that's phase one, right? Phase two has to be about community. It has to be about people, individuals sacrificing a little for the community, and so that the whole community could sustain itself, because it's something, this will go away in time. And so you need to keep everyone kind of propped up to get through this together. And it only works as a community. So, we've been seeing some mindful moments of Sarah. That's really important stuff. We have families now who have kids who aren't in school, and they may have one person still having to get into work. and then now you have kids at home. And how are they supposed to do? So even though this, the paradox here is that you have a remote company, it's great. You can work from home, but what happens if that home environment changes? And that's what we're experiencing right now, right? We have certainly have people at Rosh View who have families who now they need to care for their kids, or maybe they have parents, or whatever it may be. So what does that mean? That means that we all need to support one another. So if you are someone who is being overwhelmed right now, dealing with whatever side effect of these closures, you need to let us know so that we could help. Okay, we could provide support. Someone here could provide support, whether it's work support, whether it's information support, whether it's emotional support, whatever it is. This is not. This is the time to let us know about this. Okay, because there are things that no one will think about because it's such a rare situation. So please take a moment if you feel like you are in a situation where you can't handle something or you need help with something. Let us know. Reach out to me personally, reach out to Mike, Sarah, anyone. Put it on a public Slack. Doesn't matter. The only way we all get through this is together, right? That is the only way we do this. We need to find out, we need to know who has excess, surplus, who has expertise, who has knowledge, and to be able to share that for those that don't have those things at this moment. Everyone's life is going to be upended in various ways and different ways. Okay, we stick together, whether it's within Rosh View, whether it's in your own community at home. Communities are the way you get through this phase. All right, and we can do some more updates about this phase, and then as soon as we're into the next phase, we can start talking about that. The next phase will be interesting too. All right. Just continue to communicate. That's key. Communication is so important, and because this could be a very isolating moment, and you want to now do more, right? When you feel the most isolated, that's when you have to try your best to be able to join the community and be a part of a community. All right. So, given what I know about everyone here, I think we will find a very supportive network. All right. Have a great Monday, and we have a lot of really wonderful opportunities right now and ideas to be able to support and help the medical community right now, who is currently working on all cylinders with a lot of constraints. So let's kind of remove some of their stresses and be able to provide them with the resources they need to continue to educate the clinicians. All right, guys, talk to you later.